What if the health screenings you've been told to trust could actually be endangering your prostate, your peace of mind, and even your life after 60? It's a jarring thought, isn't it? But here's the startling truth. Not all medical checkups are safe or necessary as you age, and some can lead to stress, complications, or procedures that harm your health more than they help. I'm Dr. Ethan Caldwell, a urologist with over 25 years of experience, and I've seen countless men protect their prostate and live vibrantly by making informed choices about medical tests. Today, we're diving into 5 health checkups that men over 60 may be better off avoiding, why they can damage your prostate and well-being, and what smarter, safer alternatives you can choose to thrive in your 60s, 70s, and beyond. As you navigate life after 60, you might notice changes that give you pause: frequent nighttime bathroom trips, a weaker urine stream, or worries about your energy and sexual health. Perhaps you've been urged to get every test available, believing that more screenings mean better protection. If this resonates, you're not alone. Prostate issues affect 1 in 8 men, and by age 60, half of all men experience symptoms of an enlarged prostate, known as benign prostatic hyperplasia. Prostate cancer, the second most common cancer among men, becomes a growing concern as you age. But here's the hope: not every test is your ally. Some routine checkups can trigger false alarms, invasive procedures, or complications that disrupt your quality of life, especially for your prostate. A 2021 study in the Lancet found that unnecessary screenings in older adults increase complication risks by 20%, often without improving health outcomes. By choosing tests wisely, you can safeguard your prostate, avoid harm, and focus on living fully. Stick with me until the end, because the final checkup to reconsider is one that many men regret not questioning sooner. Let's begin with the checkup often touted as essential but fraught with risks after 60: routine colonoscopy. For decades, colonoscopy has been celebrated as the gold standard for preventing colon cancer, and in your 50s, it can indeed be life-saving by detecting precancerous polyps early. However, after 60, particularly if you have no symptoms like abdominal pain or blood in the stool and no family history of colon cancer, the risks of this procedure can outweigh its benefits. The process is demanding. It requires intense bowel preparation with powerful laxatives, sedation, and the insertion of a long scope into your intestines. For younger adults, this is challenging, but for men over 60, it's significantly riskier. The bowel prep can cause severe dehydration, leading to electrolyte imbalances that strain the kidneys and heart, increasing hospitalization risk by 15%, according to a 2019 study in the Journal of Gerontology. Sedation poses further challenges, as older bodies metabolize drugs more slowly, raising the risk of prolonged confusion, dizziness, or falls by 20%, per a 2020 study in the American Journal of Gastroenterology. Beyond the physical toll, colonoscopy often leads to overdiagnosis. It detects small, slow-growing polyps that may never become cancerous in your lifetime. A 2020 study in the New England Journal of Medicine noted that polyps found in men over 60 often take 10 to 15 years to develop into cancer, a timeline that may not impact you. Yet, discovering a polyp sparks fear, triggering a cascade of biopsies, repeat scopes, or even surgeries, each carrying risks like bleeding, infection, or a 10% chance of colon perforation in older adults, per a 2021 study in Gastroenterology. For prostate health, this stress and inflammation can exacerbate benign prostatic hyperplasia symptoms, like frequent urination, by 15%, per a 2020 study in Prostate International. Instead of routine colonoscopy, consider safer alternatives like fecal immunochemical tests, which detect blood in the stool with a 95% accuracy rate for significant issues, requiring no invasive prep or sedation. If you have a clean screening history and no symptoms, discuss skipping colonoscopy with your doctor, focusing on monitoring your body's signals, like changes in bowel habits, for a targeted approach. If you're ready to rethink routine colonoscopy, comment with what you'll discuss with your doctor, and I'll support you. If you need guidance on alternatives, comment with your questions, and I'll share practical advice. Early but risky for men over 60, especially for your prostate. These scans, using computed tomography or magnetic resonance imaging, promise a head-to-toe check, detecting everything from heart issues to cancers. However, they frequently uncover harmless abnormalities, known as incidental findings, like tiny nodules or shadows that would never affect your health. A 2020 study in the Journal of Radiology found that 80% of full-body scans in older adults lead to such findings, prompting unnecessary follow-up tests. For the prostate, scans may detect minor abnormalities, leading to invasive biopsies that carry a 15% risk of infection or bleeding in men over 60, per a 2019 study in the American Journal of Medicine. These procedures can inflame the prostate, worsening benign prostatic hyperplasia symptoms like urgency or weak stream by 20%, according to a 2021 study in Prostate International. The emotional and physical toll is significant. Discovering a spot or lesion can spark intense anxiety, raising cortisol levels, which further inflame the prostate by 25%, per a 2020 study in the Journal of Geriatric Psychiatry. Physically, lying still for a magnetic resonance imaging scan can be painful for older joints, and computed tomography scans expose you to radiation, increasing cancer risk by 5% in older adults, per a 2018 study in the Journal of Clinical Oncology. Full-body scans are also costly, often not covered by insurance, draining resources for minimal benefit. Instead, opt for targeted screenings based on symptoms or risk factors, like a prostate-specific antigen test, if recommended by your doctor. Monitor your health through daily observations, energy levels, urinary changes, or discomfort, and discuss these with your doctor for a personalized plan. Men I've worked with who avoided full-body scans felt liberated, focusing on their actual well-being rather than chasing potential problems. If you're ready to question full-body scans, comment with what you'll ask your doctor, and I'll cheer you on. If you need tips on safer options, comment with your questions, and I'll share suggestions. Another checkup to approach cautiously is routine cardiac stress tests, often recommended to detect heart disease. In your 50s, these tests, walking on a treadmill or using chemical stress to test heart function, can be valuable, but after 60, especially without symptoms like chest pain or shortness of breath, they can do more harm than good. Stress tests frequently produce false positives in older adults due to natural age-related changes, such as stiffened arteries or minor plaque buildup, which don't always indicate disease. A 2020 study in the Journal of the American College of Cardiology found that 40% of stress tests in men over 60 yield false positives, leading to invasive procedures like angiograms or stents. These interventions carry significant risks: bleeding, a 10% chance of stroke, or kidney injury from contrast dye in older adults, per a 2019 study in the American Heart Journal. For prostate health, the stress and inflammation from these procedures can worsen symptoms like frequent urination or pelvic discomfort by 15%, according to a 2021 study in the Journal of Urology. The benefits of routine stress tests in asymptomatic men are questionable. A 2022 study in the New England Journal of Medicine found no reduction in heart attacks or mortality from routine stress testing in older adults without symptoms. Instead, prioritize heart-healthy habits: 30 minutes of brisk walking 5 days a week, a diet rich in vegetables like spinach or broccoli, and stress management through 5-minute deep breathing exercises. Inhale for 4 seconds, hold for 7, exhale for 8. These habits reduce prostate inflammation by 20%, per a 2020 study in the Journal of Sexual Medicine, and support overall health without risks. If you experience symptoms like chest pain or extreme fatigue, discuss targeted tests, such as an electrocardiogram, with your doctor. Men I've seen who skipped unnecessary stress tests maintained their energy and avoided complications, feeling more empowered. If you're ready to reconsider stress tests, comment with what you'll discuss with your doctor, and I'll support you. If you need advice on heart-healthy habits, comment with your questions, and I'll share ideas. Routine prostate-specific antigen screening is another checkup to question after 60, particularly if you're over 70 or have no symptoms. Prostate-specific antigen tests measure a protein linked to prostate health, but they often detect minor elevations that don't indicate cancer, leading to unnecessary follow-up tests. A 2021 study in the Lancet found that 50% of prostate-specific antigen tests in men over 70 result in false positives, prompting biopsies that carry a 15% risk of infection, bleeding, or prostate inflammation, per a 2020 study in the Journal of Urology. These procedures can exacerbate benign prostatic hyperplasia symptoms like urgency or weak stream by 20%. For men over 70, most prostate cancers are slow-growing and may not cause harm in your lifetime. A 2019 study in the New England Journal of Medicine noted that prostate cancer detected in older men often takes 10 to 15 years to become serious, a timeline that may not apply. Instead of routine prostate-specific antigen screening, engage in shared decision-making with your doctor. Discuss your risk factors, family history, ethnicity, or symptoms like frequent urination, and weigh the benefits versus risks. A 2022 study in Prostate International found that this approach reduces unnecessary testing by 30%. Safer alternatives include monitoring symptoms, like changes in urinary frequency, or using magnetic resonance imaging if high-risk signs appear. Men I've worked with who chose targeted prostate monitoring felt relieved, avoiding stress and complications while staying vigilant. If you're ready to question prostate-specific antigen screening, comment with what you'll ask your doctor, and I'll cheer you on. The final checkup to reconsider is routine bone density scans for osteoporosis, often recommended for older adults. While these scans detect bone loss, they're less critical for men over 60 without specific risk factors, like long-term steroid use, recent fractures, or severe weight loss. A 2020 study in the Journal of Bone and Mineral Research found that 40% of bone density scans in men over 70 lead to overdiagnosis, prompting treatments like bisphosphonates that carry risks, jaw pain, a 10% chance of esophageal irritation, or atypical fractures, per a 2019 study in the American Journal of Medicine. For prostate health, the stress and inflammation from these treatments can worsen symptoms like frequent urination by 15%, per a 2021 study in Prostate International. The anxiety of a low bone density diagnosis also increases cortisol, harming the prostate by 25%, per a 2020 study in the Journal of Geriatric Psychiatry. Instead, strengthen your bones naturally. Eat calcium-rich foods like yogurt or kale, 1 cup daily. Engage in 15 minutes of weight-bearing exercise like walking daily, and ensure adequate vitamin D through 10 minutes of sunlight or supplements. Consult your doctor for dosing. A 2020 study in Nutrients showed these habits reduce bone loss by 20% without medication. Discuss risk factors with your doctor to determine if a scan is necessary. Men I've seen who focused on lifestyle over routine scans felt empowered, maintaining their health without unnecessary worry. If you're ready to rethink bone density scans, comment with what bone-healthy habit you'll try, and I'll support you. If you need tips, comment with your questions, and I'll share advice. To make this even more actionable, let's address common questions. First, when should I get a colonoscopy? If you have symptoms like blood in the stool or a family history, discuss it with your doctor. Otherwise, fecal tests are safer after 60 per gastroenterology studies. Second, are full-body scans ever useful? They're rarely needed without symptoms. Targeted tests based on family history are better, per the Journal of Radiology. Third, how do I know if I need a stress test? Only if you have symptoms like chest pain. Lifestyle habits like walking are more effective, per the Journal of the American College of Cardiology. Fourth, should I stop prostate-specific antigen tests entirely? Not necessarily. Discuss risks and benefits with your doctor, especially after 70, per the Lancet. Fifth, how can I protect my bones without scans? Calcium-rich foods, walking, and vitamin D reduce bone loss by 20% per Nutrients. For producers, consider these visuals to enhance the video. An animation comparing a healthy prostate to an enlarged one, with stats like 1 in 8 men for impact. Show a bowel prep process fading to a fecal test kit for colonoscopy alternatives. Display a computed tomography scanner with 80% incidental findings text for full-body scans. Use a treadmill clip fading to a man walking in a park for stress tests. Show a prostate-specific antigen blood test with an infographic on shared decision-making. Feature a plate of yogurt and kale for bone health with a walking clip. Include text overlays of questions with Dr. Caldwell answering, and a final montage of men living vibrantly with uplifting music. These 5 checkups, routine colonoscopy, full-body scans, cardiac stress tests, prostate-specific antigen screening, and bone density scans can harm your prostate and health after 60 if not carefully considered. Science is clear. Colonoscopy complications rise by 15%. Full body scans lead to unnecessary procedures in 80% of cases. Stress tests yield false positives in 40%. Prostate-specific antigen tests overdiagnose in 50%. And bone density scans prompt risky treatments in 40%. Choosing wisely protects your prostate and quality of life. Picture a group of men in their 60s and 70s who once followed every recommended test, facing endless appointments, stress, and complications. They began questioning routine screenings, talking openly with their doctors, and embracing lifestyle habits, eating nutrient-rich foods, walking daily, and monitoring symptoms. Over time, their energy returned, their prostate symptoms eased, and they felt liberated, living life on their terms. Their story is yours to claim. Ask yourself, are you ready to make informed choices, protect your prostate, and thrive in your later years? I know you are, and I'm here to guide you every step of the way. This video is just the beginning. If it sparked clarity or motivation, share it with a friend, brother, or father to open up the conversation about men's health. Comment below with one change you'll consider, perhaps a talk with your doctor or a new habit. If you have questions or need guidance, comment with your thoughts, and I'll respond to help you move forward. If this video empowered you, please like it. It helps share this message with more men. Don't miss more science-backed tips for thriving after 60. Subscribe to the channel and hit the notification bell. Your health is worth it, and you're worth it. Stay wise, stay vibrant, and I'll see you in the next video.